Yirenia. I'm going to be the nurse for today. For this assignment, we're studying the aorta. This assignment is for auscultation of aortic, renal, iliac, and femoral artery. Also, to check for peritoneal friction rub and auscultation of a bowel sound. I'm going to use Sarai as my patient. I'm not gonna auscultate. I'm not gonna expose her as I should in a real setting, but I'm gonna try to make my point clear, even though I'm not gonna be exposing her for privacy purposes. The first thing I'm gonna do is I'm gonna have my patient with a gown, and I'm gonna do the inspection of the abdomen. I'm gonna make sure that I don't find any mass when I'm inspecting, or any hernia, or any pulsation as I'm auscultating the abdomen. I'm gonna make sure that I'm gonna do a minimum of a 4 quadrant, and I would do it for the bowel sound. I'm gonna use the diaphragm of my stethoscope. As I'm auscultating, I'm going to be paying attention that she has positive bowel movement in 4 quadrants that she does. Also, in her case, she has positive bowel movement in sounds in the 4 quadrants. Also, I'm going to make sure that I don't find any bruits in the aorta. For bruits in the aorta, I'm going to use the bell of my stethoscope. In her case, I don't listen any bruits. And for example, if the patient has hypertension, I will auscultate for bruits also in the renal artery and the left one too, because if there's a bruit present, this raises suspicion like for renal stenosis, but most bruits have other causes as well. I would check it then if I suspect, if my patient has hypertension over the renal artery, and I would do it this way with the bell of my stethoscope. Now to the left. Also, if I suspect arterial insufficiency over the legs, I will also auscultate over the aorta, check it the right iliac artery and the left one, which would be the same with the bell of my stethoscope, looking for bruits. Also, when I'm going to auscultate the right and the left femoral artery, which is over here, I'll palpate first. And I'm going to auscultate for bruits with the bell of my stethoscope. When I'm doing this kind of auscultation, I'm going to look in this area for any inguinal hernia, any bruits in that case, and any masses that can tell me that something is going on, or any pulses I would, further evaluate. Also, for the purpose of this class, we need to assess for the peritoneal friction rub, which is produced by friction between ruptured peritoneal surfaces, example, when inflammation or tumors. If it is hair, this friction is kind of a clicking or grating noise during respiration over the liver. You will listen over the liver a friction that may be caused by malignancy. Can be primary hepatocellular carcinoma, or secondary in a case that is metastasized already. And also we need to, we can listen this peritoneal friction rub if recently the patient had any liver biopsy. And I would listen it over the liver area. To the right, you need to know the anatomy of the liver, right upper quadrant. And with this, I will conclude the, this abdomen assessment.